So here we go. Question number 26. A 19-year-old patient comes to the ED with acute asthma. Acute. His respiratory rate is 44 breaths per minute, and he appears to be in acute respiratory distress. Which of the following actions should you take first? Do I want to take a full medical history? Do I want to give a bronchodilator by nebulizer? Do I want to apply a cardiac monitor to the patient? Or do I want to provide emotional support for the patient? What do I want to do first? What do I want to do first? But the answer is B. Yeah, that's what I thought. The answer is B. Give a bronchodilator by nebulizer. The patient having an acute asthma attack needs more oxygen delivery to his lungs and body. Nebulized bronchodilators open airways and increase the amount of oxygen delivered. Physiological adaptation. Physiological adaptation. Right? Which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Yes, ABCs. Something to remember about the ABCs is that ABCs also come with your LOC. Your level of consciousness can tell a lot about what's going on with your airway, your breathing, and your circulation. Okay? Just saying. I'm just saying the largest section on the NCLEX exam is management of care, 18 to 21%, which consists of priority, delegation, assignment, supervision. So here we go. Question 27. A firefighter who was involved in extinguishing a house fire is being treated for smoke inhalation. He develops severe hypoxia 48 hours after the incident, requiring intubation and mechanical ventilation. Which of the following conditions has he most likely developed? Oh my God, my favorite word. Is it atelectasis or atelectasis? Atelectasis, pneumonia, bronchitis, or is it acute respiratory distress syndrome? That's what I'm talking about. But the answer is D. He has acute respiratory distress syndrome, right? Severe hypoxia after smoke inhalation typically is related to ARDS. The other choices aren't typically associated with smoke inhalation, right? That's physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. So here we go. Question 28. Which of the following measures best determines that a patient who had a pneumothorax no longer needs a chest tube? All right. So which one of these reasons are telling me that this chest tube can be taken out? You see a lot of drainage from the chest tube. ABGs are normal. The X-ray continues to show that the lung is 35% deflated, not dilated, or the water seal chamber doesn't fluctuate when no suction is applied. What are we thinking? And the answer is D. The water seal chamber doesn't fluctuate when no suction is applied. So that's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the fourth largest section, or the fourth largest section. Listen, management of care, pharmacological, parenteral therapies, physiological adaptation, reduction of risk potential make up more than 50% of the entire exam. It makes up like almost 60% of the entire exam when it comes to the quality of the questions and where they'll pull them from, okay? So the chest tube is not removed until the patient's lungs has adequately re-expanded and is expected to stay that way. One indication of re-expansion is the cessation of fluctuation in the water seal chamber when suction isn't applied, okay? Hey, make sure you get it. Make sure you know it. Make sure you love it. Anyways, question 29. Which of the following nursing interventions should you use to prevent foot drop and contractures in a patient recovering from a subdural hematoma? All right, is it high top sneakers, Air Jordans, as Trisha is saying? Is it a low dose heparin therapy, physical therapy consultation, or subsequent compression device? The answer was A, is high top sneakers, Air Jordans, as Trisha was saying. So high top sneakers are used to prevent foot drop and contractures in patients with neurologic conditions. Sneakers for the win. Ha ha. But physiological adaptation. All right. Physiological adaptation. All right. 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Oh my goodness. So essentially it's equivalent to a boot, like everybody's saying. That's why they're saying high top sneakers. Okay. Question number 30. Which of the following signs of increased intracranial pressure would appear first after head trauma? Is it bradycardia, large amounts of very diluted urine, restlessness and confusion, or widened pulse pressure? What are we thinking? And the answer is C. It is restlessness and confusion. That's the early sign of increased ICP, is a mental change status, right? That's a change in mental status, right? A lot of times, like I said, this doesn't have anything to do about ABCs, right? Look, y'all went straight to bradycardia, but the earliest sign of somebody that has increased pressure isn't airway or isn't breathing or isn't heart or isn't circulation. It's definitely the mental, right? But that could do for the fact of them having another issue. But you notice how that the choices weren't there. All right. So shout out to everybody that got that right. That's part of physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. All right. So shout out to everybody that got it right. If you didn't get it right, you know what to do. Circle back, get the content, get the Q&A, and get your rationale. All right, ladies and gentlemen. Hey, there we are. Right. Hey, if you need, this is a free download, 42 pages, right? Test taking tips to help you conquer the NCLEX. Then I have an ebook too. It's like over 700 pages. We do EKG interpretations. We have pharmacology over there, some delegation management assignment questions over there, over 700 pages of just deliciousness, minus the fanny pack because, you know, that's mine. Get your own 7-day NCLEX course. You guys can join for $7. Yes, $7. One more than 6, one less than 8. You can check that out. Those links are in my bio. Also, if you need coaching one-on-one, check that out over there as well. And ladies and gentlemen, of course, today on this Friday, that is a wrap. I appreciate you participating.